Welcome to the first podcast of Banega Swasth India Season 10, one of India's largest and longest running health campaign. Our focus is on creating a holistic and healthy India for each and every one. This season, our goal is One World Hygiene, where citizens, individuals, society and governments work together to ensure health for all and foster global unity for a healthier tomorrow. Nearly 200 million people had mental disorders in India according to the Lancet report published in 2019. How can we make mental health services more accessible and affordable for all? How can we make mental health a universal human right? I am Ambika Singh Kama, and on this special podcast, I am joined by Dr Pratima Murthy, Director and Senior Professor of Psychiatry at NIMHANS. Thank you, Dr. Murthy, for joining us. We would also like to tell our listeners to post their questions regarding this important issue, and during the course of this interview, we will take these up with Dr. Murthy. Dr. Murthy, thank you so much for joining us. The first thing that I would like to ask you is that if you could share some numbers on the mental health burden in India to set the context of how serious the situation is and why it needs to be a focus area in our goal to build a healthy India.
Thank you, Ambika. First of all, I think it's very important to recognize that mental health just doesn't mean the absence of mental disorder. But just like good physical health, we must talk about good mental health. But at the same time, what you've raised in terms of the burden of mental illness is something that is alarming the world over. World over, we know about 15% of global disease burden is due to mental illness. In India, we know that somewhere between 1 to 7 and 1 to 10 people have some kind of diagnosable mental disorder. And this, in terms of numbers, is a very, very huge number of people who are suffering from mental disorders. We know that the most common mental disorders are depression and anxiety, but there are also serious mental disorders like schizophrenia, psychosis, bipolar mood disorders, which, although the prevalence might be lower, is associated with a lot of disability. In fact, we also know that people with severe mental illness are likely to die 10 to 15 years as compared to the normal population. It's also very important to know that there are diseases which may not be very common but are associated with very severe disability. And therefore, for every person who has a diagnosable mental disorder, it's also important to know that there are 6 to 7 times of people who have various kinds of psychological distress, who rarely are recognized. They rarely recognize it themselves, others don't recognize it, and therefore the burden of mental illness is huge. And of course, during COVID, globally as well as in our country, we know that there's been a huge increase in mental health problems, and therefore it's very important to take it very seriously.
Absolutely, and I think the point you said here, that it's not just about the absence of mental illness or a problem, but it's also having good mental health like physical health. Dr. Murthy, of late we are seeing a rise in deaths by suicide among youngsters, students. What are the possible reasons? What are some of the signs and symptoms that family members, teachers and friends need to look out for?
With suicide, there's really a single cause for suicide, but particularly among teenagers, we know that suicides sometimes can be very impulsive, on the spur of the moment, although there may be several underlying factors and the impulsivity might just represent the tip of the iceberg. We know that feelings of stress, self-doubt, anxiety, low self-esteem, feeling low in mood, disappointment, maybe in academics, in relationships, can all push teenagers to the brink of suicide. Academic pressures, financial pressures, family conflicts are also very important. We also don't recognize the fact that depression might be something that we don't actually recognize in teenagers, and sometimes that depression can manifest as loneliness, irritability, throwing tantrums, being disobedient and being aggressive. There are several risks as far as suicide attempts among teenagers go, and it's very important to understand those risks. These include a family history, because we do know that at least a part of this kind of behavior can be associated with a family history of this kind of problem as well as mental illness. Exposure to violence early in life, continuing exposure to violence, a high degree of impulsivity, a difficulty in managing their emotions, we call them very severe disruptive behaviors, access to easy methods of harming themselves, being exposed to extreme degrees of bullying, or maybe at school. Finally, feeling very hopeless and helpless and feeling that there is no way out can all be risk factors for a person to believe that suicide is the only way that is apparent to them. And it's important to recognize all these. And therefore, it's important to recognize cries for help, especially from younger people. And this might be manifested, in becoming very withdrawn, detached from others, not eating well, not sleeping well, using substances, frequent bodily complaints, a decline in their academic as well as extracurricular activities, talking about not wanting to live. And I think both parents, teachers, friends, family, all of us need to be aware of these kind of signs and make sure we help young people through their difficulties so that they don't look at this as an option, which invariably, as I mentioned earlier, is only a sign of desperation. In fact, there are lots of people who have told us once, they attempted this, that they wish they hadn't. And that's why it's important not to allow people to get to this point where alternatives don't seem to appear.
Doctor, we have our first listener question. Bagish Kumar is asking, Ma'am, I'm preparing for a competitive exam and I've been feeling surrounded by overthinking and negative thoughts for the past few months. Please guide.
You're not alone in this. There are lots of people who, like you, are going through tremendous pressure, particularly before examinations. I remember one of the Mann Ki Baats of the Prime Minister, actually gave advice on this particular issue, because there are so many young people who feel so negative and helpless at this point. I think the most important point, of course, is not to let examinations be the end-all and be-all of your life, but to make sure that you have prepared for it, that you feel, and that means, not just doing a last-minute prep, being able to, work at it continuously, but also to remember that while you do that, adequate sleep, eating well, being able to calm yourself so that you can write your examination in a more calm state of mind is very critical. And finally, I think the result of the examination, putting in your best, is important, but also to remember the result of the examination is not a complete, indication of your ability or not, because some of us are able to do it in the first shot, some of us may not, especially if there are competitive examinations with high cutoffs, you may not be able to. So therefore, not being completely devastated by the result and preparing yourself for the eventual outcomes is also very critical, while of course you must hope and aspire to do the best.
Well, I think that answers really well for Bagish, because he is giving a competitive exam. Dr. Murthy, the next question is from Sudhir Kumar. He's asking how to keep students away from mental diseases.
Okay, Sudhir, I think the most important thing is really, to talk about how we can improve resilience. And that means several basic things. How can we kind of regulate our emotions so that we don't feel overly angry, overly upset for every little thing that comes in our way. The ability to handle stress, because invariably in this very fast-paced life, stress is a very important thing. The third thing is, as I said, we really don't pay enough attention to the importance of sleep, diet, exercise, all of which are very important for maintaining both our physical and mental health, which we should. The fourth thing is loneliness. A lot of young people, perhaps because of their temperament, because they kind of migrate from one place to another, maybe they don't know how to really build relationships, and then they feel very isolated. And sometimes social media, excessive use of the telephone, social media, etc., which kind of keeps them away from social connectedness. Strangely enough, ironically, it reduces your ability to connect with people in real life. I think that's also very important. Fifth, of course, is being able to reach out and talk to people, tell people. There's a very common saying that when you share, your burdens are halved and your joy is doubled. And therefore, being able to connect with people and get social support, all of these are very important to keep one's mental health. But at the same time, one also must learn to recognize the symptoms of mental disorder, whether it's depression, whether it's anxiety, any other kind of mental disorder as well. And because help is available. That's very important. We know now that mental disorders occur because of a combination of, maybe stress, maybe vulnerability to mental illness, and all of them causes certain changes in the brain. And therefore the person is not necessarily completely responsible for bringing on that problem. And understanding that and seeking help becomes very important.
Absolutely. I think those are very important points. The next question before I have my set of questions, Dr. Murthy, is from a YouTube channel with the name IndoFacts wants to know how to deal with the forced academic pressure from the parents. Even 90% doesn't sound pleasing to them.
Okay, I think the first thing that parents ought to realize and accept is what we call neurodivergence. That all fingers of the hand are not exactly the same. So some way, I think parents need to understand right from a very young age what strengths their children have, what the challenges they have, and how to support these. Very often parents put their own expectations of what they wanted to do and couldn't achieve on children. That's important not to do, but allow the child, nurture the child. Of course, stimulate the child in all ways, but invariably the children will kind of tell you as you grow along how, what are their strengths and what are their weaknesses and what direction they may wish to go in. So not to straitjacket a child, to recognize oranges and apples and really see their different aptitudes is also very important. Working with teachers in schools and trying to see how the child can be helped if the child has certain challenges is important. Focusing on physical activity, as I said, good sleep, etc. And of course, not to be comparative. To get the child to set goals and standards, ambitions, etc., but not to invariably be in competition with others. Competition can be healthy up to a point, but beyond a point, it can become difficult for the child to cope with. So some of these are simple strategies that parents may wish to adopt to make sure and to make the child feel wanted. Sometimes the child feels very rejected when the performance is not to par. And I think that's not a very healthy way to get the child to be more to kind of focus on doing better. So there are important supportive strategies to, of course, may inspire the child to do better, but not to make the child feel completely lacking in self-confidence and to feel a failure. That's very important.
Banega Swasth India podcast will be back after a short break.
Watch out for our new Banega Swasth India video podcast, Swasthya Mantra, the first ever public health and hygiene podcast. The podcast is live on Spotify, Apple, and YouTube in English and in Hindi.
Welcome back to Banega Swasth India podcast. Moving on, Dr. Murthy, I would like to ask you, how do we fight the immense stigma associated with mental health? Are there some successful case studies that we can learn from, since this involves changing people's perceptions or beliefs?
I think stigma is one of the biggest issues when it comes to talking about mental disorder. And that's true right across the spectrum. Even the most educated people, even the most affluent people, even the people who are professional people, there's a lot of stigma associated with mental illness. It's very easy to say I have a headache or I have a chest pain. It's very difficult to say I'm feeling anxious, I'm feeling low. So therefore, I think talking more about psychological distress becomes very important. The second thing is this thing that, while we can't control other bodily function, as far as our mind is concerned, we have to be 100% in control 100% of the time. That's again a myth. The third thing is, of course, if I talk to a professional or get professional help, it means I'm weak. There's no association between weakness and having a mental health problem or a mental health disorder. So these are very common things that people, misconceive about mental health, and therefore it becomes very important to be able to talk about it. The second thing is, of course, to know where to access and how to access mental health services. That's also very important because, very often may not be available within reach. People may not know whom to contact. People are very worried about confidentiality. But I think everyone needs to know that professional services invariably are confidential. Yeah. They do, help you to kind of get over it. And as I mentioned before, I think understanding that, talking to somebody, getting the right kind of counseling, the right kind of medication also, which is available now for a variety of psychological mental health disorders. I think understanding what's available, there are medicines, there are physical treatments, there are psychotherapies and counseling that's available. So understanding that help is available, and you can actually reduce the time of suffering by taking help on time is very critical as well.
Dr. Murthy, we have a national mental health program and also the Mental Health Care Act 2017. What do these cover currently, and do these need any sort of revision? Is there a need for a comprehensive mental health policy? What's your take on that?
So we actually have a very comprehensive mental health policy, which was evolved in 2014. We have a very progressive Mental Health Care Act 2017. And I think it's very important to state that this is what is called adopts a human rights approach, and considering that this theme is about right to universal care, it becomes very important to mention that this is a right-based, person-centered act which tries to make access to mental health care the right of every individual. It also supports people with even severe mental illness so that they can make treatment decisions by themselves. It actually is decentralized to states so that, there are state commissions which make sure that people's rights are not kind of violated in every way. Our national mental health program is now decentralized to the districts, which means that, more than 730 districts have a district mental health program which tries to improve the identification and care for people with mental disorders. In some states beyond the districts, it's also gone to the talukas, and in primary health care, looking at it, the Ayushman Bharat Health and Wellness Centers, there is a component of mental health in these centers. And of course, in terms of mental health promotion, I think yoga is something that we all know is almost like a universal approach to to improving one's mental health. In addition to that, I think people's understanding themselves, how they can improve their self-care, getting the support of communities as well as families, and then of course being able to get help as easily as possible in an affordable manner is also very critical. So that's what the national programs look to do.
According to you, Dr. Murthy, what are the current infrastructure gaps in terms of hospitals and medical professionals? And how are we planning to bridge that divide in not just cities, but also in rural parts of the country?
Yeah, I think, being such a large country, being such a diverse country, yes, having so many underserved parts of the country, it's a big challenge. And even though our numbers of mental health professionals have increased, the ratios are far below what would be the most desirable ratios. So one of the strategies to actually do that is to make sure that every health provider has basic training in mental health care, so that along with delivering physical care, the mental health support can also be provided. We can also help them to identify people with a mental disorder so that they're quickly kind of, referred to a professional who can provide that mental health care. So both these strategies become very important to make sure that the person gets care. And of course, using digital methods, and the Tele-MANAS is a typical example, yes, of how we've been able to digitally connect with the most underserved areas. In fact, the Tele-MANAS program was initiated on 10th October, which is World Mental Health Day, as you know, last year.
Yes, I was coming to that,
yes.
Including, I think there are 23 tele-mental health centers, and how much progress, if you can also tell us about that.
Yeah. So basically, the Tele-MANAS program looks at setting up Tele-MANAS cells in every state and union territory, because the mental health is not very equitably available in all parts of the country. So here, a trained counselor will talk to the individual. The individual has to call 14416, and the counselor will listen to them, will try and address their problems, will try and support them. Also identify what problems need to be seen by a mental health professional within the Tele-MANAS cell, or maybe wherever it's available. So it seeks to network all the available resources, including the district mental health program. We've had more than 3 lakh callers to the Tele-MANAS, and problems from sleep disturbances, feeling low, feeling anxious, worries about academic performance, interpersonal relationships, and of course, other behavioral problems, substance use, and the entire gamut of problems that people have come with. So I think it's given people an opportunity to talk about these. And we discussed earlier that, being aware and talking about it is the first step to actually access service.
So you believe that they are helpful and of course effective. You shared a number 14416. So please share. Are there any more helpline numbers or any other useful resource for our viewers? 14416, yes, for sure. Any other numbers or other resources?
Yeah. So in different states, there are suicide helplines, for example. There are other health helplines which people may access and try and get help. The most important thing to believe is that there is no situation where all the doors seem closed, although one might feel like that and, feel, as I said, helpless, hopeless, and feel that, there is no way out. Just reach out to somebody. It might be a family member, it might be a friend, it might be a helpline. But if you reach out, you'll find that options and solutions will become available. And that's why I mentioned the training earlier. Through our NIMHANS Digital Academy, we're not just training professionals, we're also training volunteers, who are willing to provide mental health care and support, so that we can create a complete network, so that people are sensitized to who and what's around them, and whether it's their neighborhood, whether it's their workplace, whether it's schools or colleges, that help is available and people know that help is available, so that they don't feel, that they're up against a wall at any point in their lives.
Which I again think is very critical. We'll take some more listener questions, Dr. Murthy. Dimple is asking how to improve mental health. Similarly, even Kamrul wants to know how to be free of health anxiety.
I wish I had that very easy answer to how to deal with anxiety. One has to learn how to deal with it. One can't wish it away. So one of the most important thing is something that I mentioned earlier, to learn how can you control your emotions, your thoughts, your feelings, and your behavior. There are simple strategies to do that. So that's one thing. The second thing is what Ambika also referred to in terms of lifestyle. Eating well, having good sleeping habits, very, very important to actually learn how to do that. And of course, simple strategies. For example, you talked about anxiety. What are simple breathing strategies that might help us to reduce our anxiety? Can we learn yoga or some other form of mindfulness which helps us to kind of calm down? In fact, some of these strategies actually, cause changes in our brain, which has been demonstrated through research of, reducing some of the neurochemicals and quietening some of the circuitries in the brain that cause anxiety or cause a change in mood. So that's very important. Avoiding excess of caffeine, avoiding some other substances which are likely to be addictive is very important. Forming social relationships, reducing, loneliness, trying to do something, having a hobby, for example. Music can be very calming. So learning what are the things that trigger you, what are the things that calm you, how can you do more things in your day-to-day life that calm you, and try and see how you can prepare yourself for events that might increase your anxiety, are simple strategies of how to deal with it. If it's very severe, of course, important to take professional help for that.
correct, these are things which are doable. I think it's also knowing them. Awareness, of course, is key. Dr. Murthy, Ojil is asking how to know the difference between stress and depression. When is the right time to seek help? I think a lot of people would want to know this because in today's day and age, there is so much stress, and also a lot of people are depressed because of their own, issues. So, what is this difference?
So I always say that when a person is stressed, it's like being in a pressure cooker, having a lot of thoughts and feelings really bubbling up and down, and leaving off a lot of steam. The only way for the pressure cooker not to burst with all these thoughts is that it has a valve. Similarly, I think we also have a valve, which is our ability to express ourselves or to talk. And it's very important to share when one is feeling stressed. It's important to do some of the things I talked about earlier. It's also important to learn how to solve problems. There are simple strategies on problem solving and coping with situations. But if you find that the stress is overwhelming, you've had a life event which is very, very traumatic, you're not sleeping at all, for a week or more, you're feeling low all the time, having negative thoughts, feeling helpless and hopeless, your sleep and appetite and your weight have come down. Don't wait. Check it out with somebody. And, as I said, call a helpline, get in touch with a professional, especially when there are severe biological disturbances like sleep, appetite, and weight. There are these feelings of low mood, not able to enjoy any kind of pleasurable activity which you could enjoy before, or you have a family history of proneness to depression, etc. It's always safer. You're using substances in excess. It's always safer to seek some professional help.
I think timely action is important when it comes to mental well-being. Dr. Murthy, we'll take the last two questions. Tiknesh wants to know some tips to manage stress during exam time and not let it affect your mental health. Sonali too had a similar question, so I'm going to club these two. How to deal with the stress of assignments, internships, and building a career path. How to stay motivated.
Okay. The first thing about stress is that there's a law saying if there's no stress or too much stress, there is a problem in performance. So not at all being stressed about something is also a problem, because then your motivation comes down, your drive comes down. But having too much stress is also not at all productive. So really being able, the other second thing is that you need to break down what you need to do into smaller parts so that it doesn't appear unsurmountable, which means whether it's an assignment, etc., time management is very critical. Planning and prioritizing what you need to do is also very important. Breaking down that entire thing into smaller manageable segments is very important. Preparation well in advance is very important. Getting support and getting feedback on what you're doing is very important. Learning for yourself what are your strategies that are very good to achieve it. What are the times, what are the things that are not so good? For example, you tend to procrastinate and leave it till the last minute, or do you kind of break it up? What kind of help can you get to do this are all very, very critical in planning to do a particular task. Taking breaks perhaps in between and not, kind of getting exhausted, just before D-Day is also very critical. So people say that just before these examinations, etc., getting the right amount of sleep, eating well, are very simple but important strategies to be able to do well.
Thank you so much, Dr. Murthy, for sharing these relevant and doable tips. I hope this will help our listeners. Well, that's it on the Banega Swasth India podcast this week. If you have comments, queries, or suggestions on the topic we discussed today, or issues you would like us to cover in future, do write to us on bsipodcast@ndtv.com. Remember, BSI stands for Banega Swasth India. You can also connect with us on Banega Swasth India handles on Facebook, Twitter, and Instagram, and continue the conversation through the week. Till next week, this is Ambika Singh Kama signing off. Stay healthy and stay safe.